Let's see the next question. A 24-year-old female presents with a complaint of a bump on her tongue. Clinical examination reveals a cauliflower-like lesion on the right lateral border of the tongue. An excisional biopsy was conducted and the sample was forwarded to an oral pathologist for a conclusive diagnosis. What viral infection is most likely responsible for the lesion? Is it Epstein-Barr virus, herpes simplex virus, human papilloma virus, or varicella zoster virus? Let's see the photograph. So we are referring to this lesion, this bump on her tongue, okay, which has been described as a cauliflower-like lesion. So let's find out what would be the right answer. The option A is Epstein-Barr virus. The Epstein-Barr virus is also referred to as human herpes virus 4, HHV4. So it is a type of herpes virus that specifically targets B lymphocytes. And this lesion does not cause any warty lesion, but you can see it causes something we call oral hairy leukoplakia. So instead of warty lesions, we have the development of hairy, non-wipeable white plaques, which is clinically known as oral hairy leukoplakia. So hairy leukoplakia is caused by Epstein-Barr virus, that is HHV4, and not the warty lesion of our question. So this is not the right answer. Moving on, the second option was herpes simplex virus. Now, herpes simplex virus is recognized for causing vesiculobullous lesion in the oral cavity on the lips and in the genital area. Now, these lesions manifest as blisters that rupture and form crust within a few days. Okay, so a blister will form and that will rupture and a crust will form within a few days. So this clinical presentation is not matching with the warty lesion on the tongue. So this is also not the right answer. Now remember, primary infection of herpes can affect both keratinized and non-keratinized mucosa. That means it will be found on both the keratinized surface like this and the non-keratinized surface, which is found in the oral cavity. After the initial infection, the virus remains dormant in the trigeminal nerve ganglia, and periodic reactivation may cause recurrent breakouts which only occur on keratinized mucosa. So remember, if it is a primary infection, that is the first time infection, it can happen in both the keratinized and non-keratinized mucosa. But if it is a case of reactivation, the lesions will appear only on the keratinized mucosa. The third option was varicella zoster virus. Now, varicella zoster virus is another herpes virus that results in pain and vesicular ulcerative lesion on the skin, which is innervated by a specific spinal nerve, that is dermatome in the body. Okay, so you'll find it along a specific area of the face. We say that a specific dermatome is affected. So clinical presentation of herpes zoster or shingle is painful vesicle and ulceration, typically unilateral. It is a very important feature of it, unilateral, distributed along the involved dermatome. Okay, this also does not match the warty appearance. So this is also not the right answer. Finally, moving on to the fourth option, which is the human papilloma virus, HPV, which is the right answer. So remember, HPV constitutes a substantial group of viruses which are recognized for inducing these warty lesions. Okay, they induce cutaneous and mucosal warty lesions. These lesions exhibit an exophytic cauliflower-like morphology. So remember, whenever you see exophytic or cauliflower-like appearance, it is because of the HPV. The most prevalent strains, HPV 6 and 11, these are responsible for benign mucosal wart in the oral cavity. So it is because of HPV 6 and 11. This is also frequently asked. So this is the right answer. See you in the next one.